Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Nowadays, we don't use the terminology abortion but prefer to use the terminology miscarriage. Whenever there is a pregnancy loss that happens with only the blood levels being positive and pregnancy not being demonstrated by a scan, we call it as a very early pregnancy loss or a biochemical pregnancy. For all practical reasons, if one has 2 or more than 2 miscarriages, it is called as recurrent pregnancy loss. However, the newer trend is to call it as pregnancy loss being recurrent even if it's been more than 2 miscarriages, even with biochemical pregnancy losses. Whenever there is a pregnancy loss, the mind runs to understand what could have been the cause for the miscarriage. The most commonest causes for early miscarriages are due to problems in the chromosomes of the embryo. So that is called as karyotypic abnormalities, or we call them as genetic abnormalities in common terms. The second prominent cause for miscarriages in the early pregnancy are due to blood circulation issues. A woman gets pregnant, but then due to improper blood circulation and improper blood supply to the uterus and therefore to the embryo or to the fetus, the pregnancy loss happens. This is because of excessive blood clotting that happens with the onset of pregnancy, and these are called as coagulation abnormalities. The third most prominent cause for abortion is due to infective causes. The infective causes could be rubella, toxoplasmosis, cytomegalovirus, herpes, and sometimes it can be due to infections in the sperm or in the vagina, which can flare up to an extent that a pregnancy doesn't get established in very early phases. However, the incidence of infection causing pregnancy is quite less, and therefore there's not been a concrete evidence to prove the same. The fourth and the most prominent cause for abortion, especially in the recent years, have been due to immunological causes, and more is being explored in this specialty of immunological causes of infertility. It's been discovered that women have autoimmune issues because of which they tend to reject the embryo, and therefore they either have recurrent implantation failures with an IVF or recurrent pregnancy losses in a very early phase. They can either have repeated biochemical pregnancies or very early pregnancy losses or pregnancy losses before the 7th or 8th week of their pregnancy. We have seen that treating them with immunomodulator drugs for about 3 to 6 months can increase the chances of pregnancy and also the likelihood of them continuing the pregnancy to term. These immunological drugs are prescribed 3 to 6 months before they start trying for pregnancy, and then this goes on till they deliver or even up to 6 weeks post-delivery. Prescribing these immunomodulated drugs has also proven benefit in reducing the risk of miscarriage and also reducing the risk of pregnancy-induced hypertension and intrauterine growth restriction, and therefore immunological basis of either infertility or pregnancy losses is something which has to be seriously considered, especially after repeated episodes of COVID. People have proven to exhibit the autoimmune infertility and autoimmune abortions as a very prominent cause, and therefore one should not forget to include this as one of the most prominent causes for abortion. Apart from all of these, the fifth important cause for abortion could be due to some anatomical abnormalities in the uterus itself. There could be some abnormalities in the shape of the uterus that can cause abortion, especially when there are things called septum inside the uterus. This is like a muscular partition inside the cavity of the uterus which can prevent the embryo or the fetus from growing properly inside the uterus and therefore result in an abortion. Most of these are correctable with surgeries, and the prognosis in such cases is seriously quite good. Therefore, the chances for abortion is something which is there in every woman, but whenever there is an abortion, trying to understand the cause and trying to tackle the cause is the most important one.